The number one goal for me, for each patient that I see, is to get them functioning at 100%, back to their normal self. Feeling not mostly better or much of the way better, but really to get them all the way well. And that, I think, is a shift really in our field in the past decade or two, in that we used to treat people until they were no longer severely ill and could limp around, just get by. And now the goal, certainly for me, is to get people back to 100%, back to feeling like their normal self again. When a person comes to me who is ill, I think of treating the person and also treating the disease, because you can always look at someone's illness in those two ways, and I think you need to look at it in both ways to really give optimal care. So when someone comes to me, I want to understand who they are, where they come from, how the illness has affected them, because that really informs some of our treatment choices and recommendations. And I also want to understand them in terms of the disease or the illness that's going on, because we have very good treatments for individuals. Not all treatments are appropriate for everybody, but we also need to think about this as not, especially in psychiatry, in depression treatment, this is not a failure of the person, this is a failure of certain circuits in the brain, certain mechanisms that we are trying to correct. So there's another very useful way to look at it.